Today we are going to talk about vagal nerve activation. What is the vagus nerve? Vagus means to wander in Latin. So the vagus nerve is a nerve that wanders throughout our thoracic cavity and digestion. What does the vagal nerve do? Well, the vagal nerve regulates the internal organs, the main ones being the stomach, the digestion, heart and lungs with the respiratory rate, the things we do unconsciously. The vagus nerve is a sensory nerve and consists of thousands of fibers operating far below the level of our conscious mind. It consists of 20% efferent fibers and 80% afferent fibers. Afferent meaning communication from outside, i.e. the skin, to the central nervous system, and efferent meaning communication from the central nervous system to the outside. Polyvagal therapy and chronic fatigue syndrome. Polyvagal therapy is a type of therapy that aims to regulate the autonomic nervous system through specific techniques that promote the activation of the parasympathetic nervous system. As chronic fatigue syndrome involves the dysregulation of the autonomic nervous system, polyvagal therapy may be beneficial. It regulates the autonomic nervous system by recognizing which state we are in, either ventral vagal, of safety, social engagement and connection, sympathetic, mobilized, agitated, a frantic stress state, or dorsal, numb, collapsed or frozen state, disconnected and shut down, or sometimes it can be a blend of all these states. Developed by Dr. Stephen Porges, polyvagal therapy suggests that the autonomic nervous system is not a simple on-off switch between the sympathetic and the parasympathetic systems, but rather a complex system that responds to different environmental cues. It serves to identify the relationship between visceral experiences, our sensory nerves that detect what's going on in our external and internal environment, and the vagal nerve control of the heart, lungs and digestive tract. Called neuroception, it is the detection of our body without awareness of how we respond to stress. People with chronic fatigue syndrome may experience an overactive sympathetic nervous system or maladaptive stress response and an underactive parasympathetic nervous system, which can lead to symptoms such as fatigue, pain and cognitive difficulties. Polyvagal therapy regulates the autonomic nervous system by promoting the activation of the parasympathetic nervous system, in turn reducing these symptoms. Techniques promote relaxation, reducing the impact of stress on the body, helping people with chronic fatigue syndrome to improve their ability to cope with stress, which is often a trigger for symptoms, and develop a greater sense of control over their symptoms. Polyvagal theory explains how by activating the vagal nerve, we can help bring ourselves into a social engagement state of calm and safety, and out of the lower sympathetic and dorsal states. If you are in a dorsal state, you need to be mobilized maybe, safely before practicing calming techniques. Safe stressors, for example rocking, movement, walking, colouring in or crafting can help. Therefore, it's important to know where you are on the polyvagal theory ladder to know how to move up to the ventral vagal state. Activating the vagus nerve stimulates the dorsal nerve, and when you are in a state of calm and in a safe environment, this allows for play, intimacy and stillness. You cannot just stimulate the dorsal nerve alone. You cannot differentiate between the two as they both exit from the skull from the same place and connect to the same sensory nerves. Polyvagal theory explains how we need to be in a social state of engagement to calm the body. Therefore, social connections with family and friends are important in calming the nervous system, as a ventral activation is a co-regulated experience. When you are happy and calm with others, you're sending cues of safety, and they will also be happy and calm. For example, when a mother is breastfeeding her baby, the baby feels safe and calm, which makes the mother feel relaxed and calm. This comes from our evolutionary survival instinct. In other words, social connection is beyond a desire. It is a human need, and co-regulation is the warm feeling you get from interacting with friends, loved ones, and our community that fosters positive emotions, which in turn improves the function of the vagal nerve. You can find out more about polyvagal theory regarding trauma and the state of immobilization in the references at the end of this presentation. The vagal nerve and the parasympathetic nervous system. The parasympathetic nervous system oversees calming the body's organs after a stressed flight or fight immune response. As the vagal nerve is a crucial part of the parasympathetic nervous system, it is therefore the main parasympathetic outflow from the gastrointestinal organs and heart. After a stress response, to switch back into the parasympathetic mode of functioning, the rest, digest and repair state, the vagal nerve helps by supplying nerves to the smooth muscle of the gastrointestinal tract that stimulate muscle contraction and glandular secretions. This increases the rate of gastric emptying and stimulates acid production. It regulates the heart rhythm by stimulating a reduction in the resting heart rate, supplies nerves to the smooth muscle of the airways to the lungs, controlling and regulating your breathing in stressed and calm situations, including your defense mechanisms and normal breathing patterns. The gut-brain axis connection. The gut-brain axis is the communication channel between the stomach and the brain. This interaction involves the immune, endocrine, and autonomic nervous system. The vagus nerve plays an extremely significant role in this connection as it picks up or senses the microbiota chemicals and relays this gut information to the central nervous system to produce a response. The microbiota is a mixture of microorganisms that live in the gastrointestinal tract and is host-specific. It is constantly evolving and is susceptible to internal and external changes. Gut-brain axis stress and the vagus nerve. Stress can impair the vagus nerve because it is the communication channel between the brain and the gut. Stress has a harmful effect on the gastrointestinal tract and microbiota. An imbalance of the microbiota function resulting from the activation of the body's fight or flight response. This influences the gut-brain axis, leading to mental health conditions like anxiety and depression. There is a two-way communication directly influencing each other and its behavior. Stress signals from the brain influence digestion, and the gut signals similarly influence the brain. So just a bit of a recap. Communication is made possible by the gut-brain axis. There is an association between the gut-brain axis and a healthy brain. To have adequate mental health, you need correct communication between the gut bacteria and the brain. Stress is involved in the pathophysiology development of gastrointestinal disorders such as irritable bowel syndrome, irritable bowel disease, colitis, and celiac disease through the gut-brain axis connection. So why stimulate the vagal nerve? The vagal nerve plays an anti-inflammatory role through the endocrine system by stimulating the vagal fibers of the hypothalamic pituitary adrenal axis. Triggering a release of cortisol, it is now being used in the treatment of long COVID, and polyvagal therapy also helps explain the decrease of mitochondria function. Robert Navarro, a mitochondria expert, research noted that the mitochondria followed the rules of the polyvagal theory. When the things are good, they socialize and reproduce, and when things are bad, they hunker down, and when things are really bad, they die off. It's all about the signaling at that level, the cell danger response. Because the vagal nerve is a key element of the brain-gut interaction and autonomic nervous system, vagal nerve activation can target inflammatory conditions of the digestive tract, i.e. IBS, IBD, colitis, celiac disease. It helps by dampening outer inflammatory and decreasing intestinal permeability, therefore probably controlling microbiota composition. Also, vagal nerve activation in the gut can influence brain functions that are responsible for psychiatric conditions, anxiety and mood disorders. It has been shown that people with digestive issues usually have low vagal tone. A person with low vagal tone means their nervous system is out of balance, more in the sympathetic stress state. People with high vagal tone can self-soothe, have better resilience, and bring the nervous system back into that parasympathetic mode of function more easily. We will talk later about how to check your vagal tone and exercises that stimulate the vagus nerve to increase the vagal tone. Vagal nerve stimulation improves low vagal tone, which is measured by the heart rate and facilitates the adaptive response to environmental challenges. For this reason, restoring normal vagal tone can help in gastrointestinal diseases and mental health issues. How to activate the parasympathetic nervous system with vagal nerve therapy. As recent evidence supports vagal nerve activation and its effect on gastrointestinal function, there are therapeutic tools that target the primary neurotransmitters within the parasympathetic nervous system. These include complementary therapies such as hypnosis, meditation, mindfulness, yoga, and new methods to stimulate the vagal nerve such as specific breathing practices, movements such as rocking and massage, specifically the ear and neck. However, breathing influences mood and physiology differently than mindfulness meditation because it modulates vagal function. Research has shown that specific breathing practices, particularly prolonged exhalation or sighing, is more effective and faster in vagal nerve activation to promote positive effects to emotions and physiology than meditation. Vagal tone is influenced because of its association with stress response capacity, and increased vagal tone contributes to better resilience and the easing of anxiety and mood symptoms. Because the vagus nerve innervates with the soft palate and our nasal passages, we can check our vagal tone and autonomic nervous system function by using some of these techniques. Firstly, look in the mirror or take a video of yourself on the phone. Make the ah sound as you breathe out. Notice if the piece of tissue at the back of the throat is deviated to one side. If it is deviated, this means there is a vagal nerve dysregulation or imbalanced state. If it moves up symmetrically, it means you are in a balanced nervous state or social engagement state, a ventral vagal state. Another practice could be placing your index finger under your nose and breathing out through your nostrils gently. Notice what nostril you feel the breath more prominently. If it is the right nostril, you are more in the sympathetic, energizing mode of functioning, which is what we need sometimes when we need to get things done. If it is in the left nostril, you are more in the rest, digest, repair state, the parasympathetic nervous system. If you are in bed at night trying to sleep and you are breathing more from your left nostril, this is indicative of low vagal tone, tired but wired. Another way is just to check in with yourself and your autonomic state. Close your eyes and check in with yourself. How are you feeling right now? Are you thinking about things that have happened? Or worried or anxious about things in the future? Do you feel that there is this dark cloud of anxiety hovering over you? Or are you able to let things go? Just answering these questions can actually allow us to acknowledge where we are in our autonomic nervous state. Vagal nerve activation breathing practice. We stimulate the vagus nerve from breathing patterns that create changes in stroke volume and intrathoracic pressure. These changes in pressure are picked up by the nerves that communicate to our brain via the vagus nerve, the heart-to-brain communication. If you find it hard to ground yourself or center yourself before you start these practices, then maybe you can sit on a Swiss ball or even in a chair and do some gentle rocking. This helps you come up from the immobilization state or dorsal state to the ventral vagal state of calm and safety using some mobilization. The primary breathing muscle is the diaphragm, and when we inhale, we create more space for the heart because the diaphragm is contracted and flattens down. This increases the stroke volume and decreases intrathoracic pressure, which results in a faster heartbeat. When we breathe shallow with more emphasis on the inhalation, we actually create a stress response. When we exhale, the diaphragm moves up in a dome-like shape, relaxes and decreases the stroke volume, increases intrathoracic pressure, which slows down the heart. Therefore, it's in the exhalation where the magic happens. Prolonged exhalation that creates large diaphragmatic movement triggers a reaction in the brain that tells the heart to slow down, promoting relaxation and in turn upregulating and stimulating the parasympathetic response to rest, digest and repair. When we spend more time exhaling, we spend more time activating our vagus nerve. 3 things we can do when breathing to activate the vagus nerve are Ujjayi breathing. This is when we vibrate the vagal nerve which runs down either side of the neck, promoting nerve activation by oscillating the throat. Things like humming, chanting, singing or omming can help this. You can also imagine making the sound ah, as in father, when you breathe, or imagine that you are fogging up a mirror and exhaling with the ha sound. Make that sound of your mouth closed and breathing through your nostril on the exhalation. The next thing is the chin lock. This is when at the top of the inhalation you close your nose and drop your chin to your chest. This gently compresses and releases our vagal nerve, amplifying the rest, digest, relax response. And lastly, it's doubling the length of our exhalation. So when we breathe slowly, specifically when exhaling, our diaphragm spends more time relaxed and snuggled up against our heart, therefore increasing the vagal nerve communication to our brain to slow everything down and stimulate the parasympathetic nervous system. Here is a practice that you can do. Inhale through both nostrils for 1, 2, 3, 4. Close your nose, lock your chin and hold. 2, 3, 4. Lift your chin and exhale to the count of 8, 7, 6, 5, 4, 3, 2, 1. And repeat this practice for 10 rounds. Another practice is the humming bee breath. This is when we inhale deeply through our nose and exhale, hum slowly and with a low resonance. Just make sure that your jaw is relaxed and allow the hum sound to vibrate your mouth and jaw. Repeat this for 10 rounds. This practice helps to stimulate your vagal nerve and also increases the level of nitric oxide release in the paranasal sinuses, which is a bronchodilator and vasodilator, so helpful for your cardiovascular health. There is another practice in the resources that accompany this presentation. Ear massage, stimulating the primary nerves connected to the vagal nerve auricular branch. Holding the ear gently with your thumb and your index finger, pull your ear away from your skull. Notice any tightness, soft or firm tissue. Can you move or wiggle it? Now place your index finger gently outside the entrance to your ear in the opening of the ear canal and press back towards the back of the head. Make gentle circle movements, moving the skin, just giving sensory information to the nervous system. You can make small little circles forward, 1, 2, 3, 4, 5, then reverse. 5, 4, 3, 2, 1. Be very gentle and try up to 10 rounds of this movement. And then you can place your index finger in the hollow just below the ridge and above the ear canal opening. Make gentle circular movements, moving the skin in circles without too much pressure. Again in one direction. 1, 2, 3, 4, 5, and the other direction. 5, 4, 3, 2, 1. And you can do this again for up to 10 rounds. Now as you're doing this, I just want you to notice any sensations in your body. You may notice a response as you do these movements, so it can be a sigh, a yawn, a swallow, or just your breathing slowing down. This is a message from your body telling you that it's switching into the parasympathetic mode of functioning. Now holding your ear gently with your thumb and index finger, pull your ear out. Hold, then down and away, hold, then up and away, hold. Place your index and middle finger on the skin just behind the ear in front of the hairline. Move the skin up and hold. No pressure, just moving the skin and releasing tightness. And now move the skin down towards the shoulder and hold. Stretch the skin back towards the back of the head and hold. And release. Now again, holding the ear gently with your thumb and index finger, pull your ear away from your skull and notice any difference in the tissue. Again, is it soft or firm, or can you move it or wiggle it more? For our last practice, we have an eye exercise. So you can be lying down or sitting. Just move your head from side to side slowly, noticing any sensations, stiffness, difference between the left and right sides. And now lying down or sitting, place your hands behind your head, interlocking your fingers. Keeping your head exactly where it is, I want you to move your eyes to the right and hold for 30 seconds. And then slowly move your eyes back to the center and relax. Now we're going to move our eyes to the left and hold again for another 30 seconds. And releasing, bringing your eyes back to the center. So now, moving your head from side to side like you did at the beginning of the practice. I just want you to see if you can notice any difference in the movement. Is it any easier or is it the same? I'd like to thank Deb Dana, Stanley Rosenberg and Stephen Porges for their excellent information on polyvagal theory and exercises to help switch into the parasympathetic mode of functioning. For further reading, I do really strongly advise you to seek out these resources. Thank you.